My name's Travis Cockle. I'm a nursing student here at Connor State College, and I'm nearing the end of the program. I thought I'd give you some insight on the importance and relevance of the general education courses that you need to prepare for either the Connors Nursing Program or ICTC's Occupational Therapy Assistant or Physical Therapist Assistant programs. And I'm sure at one point in time you probably asked yourself, how are these courses relevant to a career in healthcare? I know I have. So I want to hit you guys with some wish I'd known then or what I know now type of knowledge. So I got my notes here and I'm going to give you a little spill about these general education courses. So starting with your biologies, anatomy, physiology, microbiology, these courses help you become familiar with the human body and how it functions, but you want to move beyond that basic familiarity. Really master these subjects to prepare for the rigor of the healthcare programs. Obviously, you're going to continue to use the material learned from these biologies throughout any healthcare program and in the profession once you get into the field of healthcare. Intro to nutrition. Nutritious food choices are important in preventing illness, especially chronic illnesses such as diabetes and heart disease. And good nutrition is crucial to the recovery process for your patients. Your knowledge of good nutrition will make you a more effective and valued healthcare professional. Mathematics. This is essential in the nursing process. As a nurse, you'll be responsible for calculating and converting dosages, monitoring progress, and utilizing math in virtually every patient interaction. As an OTA or PTA, competency in math will be necessary to calculate range of motion, describe angles, compute and track percentages, and in various other scenarios to assist your patients and clients. Fundamentals of computer usage. Now that the healthcare industry has become computerized, you have to be able to navigate your way around a computer and manipulate software. You have to be able to navigate through patients' electronic health records, and you may be responsible for procuring medicine from computerized locked cabinets. Psychology. So as a healthcare professional, you'll work with a lot of different people. Psychology can help prepare you to serve your patients or clients better. For instance, a basic understanding of psychology can help you avoid taking negative interactions personally, as well as develop skill in identifying certain behaviors as a symptom of disease, as a side effect of meds, or simply the patient's reaction to the stress of being in a healthcare facility. Humanities. This helps us make sense of our lives and our world. It helps us understand others through their languages, heritage, culture. This study encourages us to reason with better insight into the ethical questions that arise within healthcare. U.S. history. Understanding how history has unfolded over time creates a well-rounded person and helps people and a society as a whole learn from the past. American federal government. This provides an awareness and appreciation for our country's form of government and provides a template for organizations that are based on majority rule. Healthcare professionals who see a need for change in their environment can address the situation through proper channels and work to change laws through the democratic process. English Comp 1, Comp 2, and Intro to Oral Communication. In healthcare, you have to communicate with the patient or client as well as other healthcare professionals. Healthcare professionals are responsible for writing healthcare plans, case studies, professional emails, and accurately conveying information during patient handoff. So, that's why these courses are required to get into the nursing program or OT or PTA programs. Check your degree requirements for specific classes for the program you've selected. There are more qualified applicants applying to these programs than there are seats available, so start preparing yourself early in your college career to become a competitive applicant to the program you're pursuing. Don't plan on just getting by. Instead, work to master the content taught in each of these courses while you have the opportunity. You need to know the material. For one, to prepare you for the rigor in each of these healthcare programs, and two, to be a competent healthcare provider within your scope of practice. In closing, I want to encourage you to begin with the end in mind. Define your end goal and work hard to achieve it right from the beginning, starting with your general education courses. And hopefully in the future, when you're a student in a healthcare program, you won't look back and say, I wish I'd known then what I know now. Because now you know.